Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
Well, welcome back. This is Beyond the Superficial with the doctors at Synapse Center for Health and Healing in Eagan, Minnesota. My name is Dr. Amber Janetsky. I'm a chiropractor, a functional medicine doctor, functional neurology, and I also do acupuncture. And
I'm Dr. Ashley. I'm also a chiropractor and functional medicine provider here at Synapse.
Well, today we're going to be talking about inflammation. And we were just talking about how we have patients ask us that, and sometimes we're deer in the headlights when we're like, what is inflammation? We get so used to just saying, well, it's inflammation. Well, duh, it's inflammation, but what is that?
Yeah, that word gets thrown around a lot.
Yeah.
I would say.
So
and it's not like it doesn't exist. I mean,
right.
it's everywhere.
Right. Yeah, and it's not always good. It's not always bad. And so we're just going to touch on that a little bit and some key points on it. So thank you for joining us. So the first thing, some of the inflammatory markers that we can look at are cytokines, which are just chemical messengers that trigger that inflammatory response, which are things like swelling, bringing immune system to the area for healing. And then prostaglandins are another one. Those are just fat type molecules, kind of like hormones that again kind of do that signaling and can cause things. Typically for an acute reaction, it's a good thing. We want to bring that healing to the area. Yep. It's more of an issue when it turns bad is when it's more of a chronic issue. Mm-hmm. So yeah, what do you have to say?
Yeah, essentially, inflammation, it's important, but essentially it's just various types of cells and molecules. And a lot of those cells or molecules are there for a purpose to really allow our body to repair itself and to fight off infections. So it is a good thing, but like you said, it's a matter of controlling it or like taking care of it and making sure our body is primed so it can take care of it. So
yeah, so some kind of trauma can trigger it, an infection, exposure to environmental toxins can trigger it, and so we want to try and reduce those as much as we can so we don't have that chronic inflammation going on.
Yeah, and eating the right foods.
Yes.
What would you say the main difference is between acute and chronic inflammation?
There's not, I guess in my understanding, maybe it has something to do with the level, but I'm not versed enough on it to know if there's really a chemical difference. I mean, it could be exactly the same. It's just one is going on for longer than it should.
Exactly. I was thinking timeline.
Yeah.
Like where chronic is months to years.
Right.
And then acute is kind of like that quick, like cold or virus or trauma to that area, like a car accident or a sprained ankle.
Right.
So like usually timeline is kind of what I think of.
Yeah. So kind of interesting. We do some testing for looking for inflammation, and some of them, one that we don't do very often because it's not a very simple thing. We do look at cyto-DTX or DX. I guess it might be DTX. But this just gives a whole list of different cytokines that can be elevated. And what I find pretty fascinating is that they work together. So if one cytokine is present, one form of cytokine is present, that'll affect how another one might work. And so if it's present, this cytokine will work one way. If it's not present, that changes the function of the cytokine. So it's kind of cool kind of learning about that too. So it's pretty complicated interplay that can happen. What are some other markers that you look for in blood work?
I was just thinking from the cytokine too, like when we run like line panels or infection markers, like sometimes that cytokine marker has been 0 and we're like, why, how is this even possible? Or, they're actually out and doing the fighting in the peripheral tissues and stuff like that. So it's kind of interesting how labs like that can just tell you a story. But yeah, on our labs, usually like on our Biored standard, we look at inflammation through CRP, C-reactive protein, so more of a systemic inflammation. CRP can can be elevated in acute situations and chronic situations too. So it's a great marker to track progress as well, and identifying what might be causing the issue. Another one is ESR, estimated sedimentation rate. Another marker that we'll use. I like to use LDL too, the cholesterol marker, as a marker of inflammation too. Like, what's going on? Is infection raising the cholesterol? Do we just need to quench some inflammation from bad eating habits or alcoholism or whatever it might have been? Because usually people look at cholesterol as like, I'm eating fine. Well, the LDL's up. It's a red flag. Something is causing an issue there. Those are kind of the big ones that come to my mind.
Yeah, I mean, along with LDL, I haven't heard of LDL. That's interesting because, yeah, I guess if the liver is affected too, it's not going to package those LDL. And toxins are one thing that can affect liver. So if those are elevated, you're going to have poor liver function. But HDL cholesterol, that's one that people don't often know, is that when we always think HDL cholesterol is good, but when it gets beyond that 100 range, then we're looking at there might be an inflammatory reaction causing that. So then it's not considered so good. Uric acid is one that I look at for like an inflammatory. Anion gap is another one that I kind of look at for inflammation.
Yeah, look at ferritin a lot.
Yeah, ferritin.
That's really high.
Yep. Any kind of inflammation, infection, cancer, those kind of things can raise ferritin. So those are some key markers there.
Yeah.
What are some symptoms that you correlate with you must be inflamed?
When it comes to acute, like usually we'll have, let's say if it's a physical trauma and acute that way, like we'll have the redness, the swelling, stuff like that. But if it's more of chronic, that's where it kind of gets interesting, because you might not even know what's going on the inside. Like you might feel a little bit tired or fatigue or something like that, because usually the chronic inflammation those are the things that are there that's maybe causing the autoimmune or the heart disease, things like that. So you might not even know it's there until we can see a little peek of it in the labs, or just like little hints of, like I said, like the fatigue, and it's not necessarily like raging in your face. It can be hidden.
Yep.
Yeah. What do you think?
Some interesting ones that I often will hang my hat on is, one, if you're having really bad period cramps or problems with your cycle, heavy bleeding, that can be sometimes a sign that your prostaglandins are too high, because as you get near your cycle, the period cycle itself will raise those prostaglandins. So if you're already elevated in it, and then it raises more, you're gonna have more problems with that. And so whenever, like if I start having something like more cramps, I look to what am I doing that might be raising some inflammation. I mean, we've talked about this before, but when I used to use regular non-organic tampons, and I had cramps. As soon as I took those out and brought that inflammation down, no more cramps. The other day I had to use one from the gym, didn't even think about it, and I was like, why am I having cramps? It's like, oh my gosh. I mean, it can be that like crazy of a difference. Also body joint pains. I know for myself too, like when I have gluten, my back, my SI joints hurt, so it's kind of going towards, maybe where you've had an injury before, or maybe where there's some more degenerative arthritis going on, that inflammation just goes to that joint. That's what I see. And so when it starts to rise, you'll kind of notice it in those joints that maybe you've injured, or maybe there's more chronic injury or overtime injury, repetitive movement injury. You'll notice that when the inflammation starts to rise.
Yeah, I kind of think of like GI issues too, like any sort of like chronic like bloating, GI cramping in that way too. Like clearly there's an inflammatory response going on in the gut too.
Yeah,
and kind of coming back to the marker thing though, leptin, like that's one I'll look to if they're having GI issues. I'll take a peek at the leptin and seeing, is there some small intestine inflammation going on in there, or even if like there's a lot of histamine or like sneezing, even like snoring, things like that, or there's like a histamine reaction. I'll also look at that leptin too, just in case if maybe we have a little bit of mold issue going on.
Yeah, and if you're having seasonal allergies or allergy to things, I mean, that's a sign too that your just general inflammation is heightened. Another thing is depression.
Oh yeah.
Some theory or some research talks about it's brain inflammation, and they think that even just psych meds, one of their mode of actions is actually to reduce inflammation in the brain, and that's why it works. And so if you're having depression, brain fog, that can be a sign that there's inflammation in the body, and we're always trying to find, well, what is causing that? What are some triggers?
Yeah, there's one marker on the Dutch test. Of course, I'm not going to think of it. It's the last one on the organic acid test, the 8...
OH.
Yeah. Because that, in a way, that's a neuroinflammatory marker, too. That's actually a marker that, if it's very elevated, it can indicate even, like, there could be some cancer going on, or, like, it's a pre-cancer marker, too, that you can kind of look at.
Kind of indicates any kind of oxidative stress.
Yeah,
anything that can raise that oxidative stress, because that's what what this does is it increases the free radicals in the body, and that's where we get some of that long-term damage and leading to DNA damage.
Yeah, because even with hormone imbalances too, that'll regulate your ability to fight off inflammation. And I've had patients with like the joint pain, and hormones have been off, ran hormones, and their hormones are tanked or like very not balanced at all, and just problems with detoxing estrogen. So even hormones play a huge role in how you regulate inflammation, or being a cause of the inflammatory process.
Yeah, because sex hormones regulate the immune system.
Yeah.
They modulate it. So it can definitely throw things off.
Yeah. Let's see. Next. How does inflammation contribute to the development of various diseases?
Well, kind of what we just talked about is that free radical formation, and then just that tissue damage too, right?
Yeah.
It's meant to be there to help, but then when it becomes chronic, then we just have that repeated insult, and so we have to deal with those free radicals and neutralize them.
And you brought this up earlier, how like that literally, or inflammation changes the way you replicate DNA too. So it'll turn like off and on genetic SNPs too, and can lead to cancers and things like that as well. So we definitely want to be aware of our inflammation, which kind of brings us to the next question, which I like this question. What are the most important things to understand about inflammation in order to manage your health? Well, just understanding it means you'll be able to know where it's coming from.
Right.
So that's where labs come in handy.
Yeah.
Because you know exactly where it's coming from, how we need to fix it, and just tells us some really great information.
Yeah, so some things that we might look at is that, total tox burn test, which we probably have touched on before, but that looks at environmental toxins, mycotoxins, and heavy metals that can all cause some of this inflammation and free radicals that we need to neutralize. What are some other tests? I mean, KBMO, FIT tests, looking at food sensitivities, that's a huge one.
Yeah.
I mean, if you're chronic, just every day eating a food that's causing some insult to the body, that's not good.
Yeah, and even with food allergies too, like not everyone gets that same inflammatory response or sign and symptom the same way. Like it's not just going to be a GI issue, but it can actually be, eggs might be triggering your depression, anxiety. Like I've seen that before, where they cut out, a certain food and their depression, anxiety symptoms went away completely. So food allergies are kind of an interesting one where it just affects everyone so differently. So they can be helpful.
Yeah, and that's a good point to bring up, is that there's a lot of different food sensitivity and allergy testing out there. So an allergy is different than a sensitivity. So that is an example of the different types of immune cells and inflammatory things that occur in the body. So we test certain types of cytokines that show that you actually have inflammation occurring, where some of the tests out there only look at, like IgG testing, it just shows that you have exposure to the food, not really showing or proving that you're having inflammation from it. And then there's actual true allergies, where this is more of, I'm getting hives, I'm getting respiratory symptoms, my throat's closing up. That's a food allergy, and that's an IgE response. And so we can look at it from those different ways with testing.
Yes. And heavy metals was another one I was gonna bring up. We see that quite often where you wouldn't expect them, because heavy metals they can get in through your water systems or metal amalgams, things like that, and that will cause just a crazy inflammatory response to the blood vessels. So that's when I see a lot of times that LDL will be super high, or even like into the brain, causing some brain fog and inflammatory issues in there as well.
So we have these free radicals running around. We have this inflammation going around. Like, what are some supplements and diets, lifestyles that we can do to help with that?
One thing, kind of like my first go-to, is doing something simple, just like fish oils. So like some patients, if they are people, this is me at one point, where I go out into the sun and I instantly just like turn red, like I am burnt right away. That can be a sign you just don't have enough fish oils to support that skin barrier. So fish oils is one of my first go-tos, is fighting off some of that inflammation. So probably one of my favorites, fish oils and pro-resolving mediators, all of those.
Which you can take supplement form. Otherwise, your body has to turn the fish oils into that. Sometimes we don't have the coenzymes to do that. So that's where sometimes taking the actual pro-resolving mediators can be more of a benefit. Yeah.
Fruits and greens. I like the powder. Just get those antioxidants, because the antioxidants, those will actually quench those free radicals, those extra oxygen molecules running around in the blood. So just balancing the pH of the blood with the antioxidants with fruits and greens, eating them or drinking them with a powder. For eating them, of course. But
I'm always a fan of eating them.
Yeah.
There's just so much more. Like when you start processing food, I just think some of that is lost.
Yeah.
But it's better than not doing anything. If you I can't do fruits and veggies right now, maybe that's then the next best thing. Yep.
What do you like to use?
Turmeric is probably my number one go-to.
Oh, yeah, for sure.
And then resveratrol, glutathione, vitamin C, all of those are really great antioxidants to just help quench some of that water, good healthy water, supporting those detox pathways. Those are all great ways. And then looking for, go ahead, you had more supplements.
You said supplements, but I was thinking when you said like vitamin C and glutathione, like when we do see a very large inflammatory load, whether that be infection or toxins, that's where, we're able to do IV therapy too. So like putting that vitamin, but in a very high dose to really get into the serum, bypass the gut and liver and everything, and just take care of it through the IVs. So it's really helpful too.
And the other thing to deal with it is avoiding making it.
Yeah.
And so finding, like, if you do know that your heavy metals are high, for example, finding the source of that so you're not getting repeated exposure, looking on ways to avoid environmental toxins, looking for ways to decrease mental stress in your life, getting good sleep, exercising. And that's one thing. Exercise is kind of, depending on how and what you do, can raise inflammation as well. So just kind of finding your sweet spot in that area.
Yeah, grounding was another way.
Yeah.
I thought of just decreasing that inflammatory load. But yeah, exercise creates an acute inflammatory response to make a good change. So it's a good inflammatory, kind of another example of where inflammation is good. Kind of like when you're weightlifting, when you weightlift, you have little micro tears in your muscle, and that's a good thing because that means we're going to get hypertrophy. So that's where you might get a little sore after a workout, which is totally fine. And that's where we get into the problem areas with exercise if we're overtraining. So if we're doing lots and lots of hours of training and under recovering, so we're not eating the right things, not eating enough, that's where we can get symptoms of overtraining and getting the not right inflammatory response.
Yeah, that even leads to leaky gut. Like running, for example. Running a short amount of time is great, 3 to 4 miles. Beyond that, then we start to see leaky gut occur. And leaky gut comes and goes even throughout your day, but that can be one thing, just getting too much. Yeah.
How about stress? Like, how does stress cause inflammation?
Well, it's going to increase your stress hormones, which is just going to cause a release and an increase of that reactive oxygen species occurring.
Yeah, too much cortisol running around in the body and increasing blood glucose and all that.
Yeah, probably
Yeah.
using up cellular energy. I mean, you're driving your cells more, so they're just going to produce more of that anyway. Yeah.
Mhm. When I think one thing we've been running into lately too is MARC-ONS, or like the inflammation in the brain too. The stress kind of made me think of the brain inflammation. But one of the tests that we do here too is a nasal swab MARC-ONS, and it's essentially a what am I?
Looking for
The
a section?
strep, yeah. It's a type of strep that can be antibiotic resistant, that
Yeah.
can cause a lot of brain inflammation and lead to Alzheimer's too. So it's just another thing I thought about with stress and the brain and testing.
Yeah. Any other good questions?
I think we hit most of them.
So yeah, I mean, if you're starting to notice that, I'm just, my joints ache all the time. I have brain fog. I'm fatigued. I have swelling, inflammation, those kind of signs can be a sign that you're struggling with some inflammation, and we can definitely run some labs or basic work on diet lifestyle to try and mediate some of that. And also just getting an adjustment, getting things in alignment takes stress off of those joints, helping them work better. All of that sends feedback into the nervous system. The nervous system controls your immune response as well. So those are some good things that we can address here.
Yeah, exactly. I don't think I have anything else to add.
Okay, well, thank you. Thank you for joining us.
Yeah, like and subscribe.
Yes, we'll see you next time.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com, your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.